I'm Dr. Kelly Starrett from the Ready State, and we're talking about how we might think about H-Wave as part of a greater systems approach to helping manage chronic persistent pain. Now, first and foremost, the H-Wave device itself is a movement device. Whether we're simulating movement without motion, right, we're creating non-fatiguing muscle activity, which signals that it's okay and I'm removing waste, or I'm using the H-Wave high frequency to create a window of opportunity where I can become pain-free so that I can move. We're still thinking about the body as a movement system. And so that kind of leads us to think a little bit further about some keystone behaviors that should go along with using our H-Wave when we're managing chronic or persistent pain. The first is, I want to make sure that people are moving to the maximum of their capacity and ability, which may mean that, hey, our benchmark for able-bodied people is to try to get 8,000 steps a day. We're trying to get you outside. We're trying to interact in our environments. We're also trying to decongest and load the body in sort of normative, pain-free ways. And that locomotion, just walking around, is really important. For you, that might mean, hey, I need to just walk around my kitchen island 10 times today. So regardless of where we are on the spectrum, we're going to try to max out our non-exercise activity. And that might just mean I literally have to go for a quick walk and then lay back down on the ground with my feet up to try to sort of feel like I can kind of bring that threat back under sort of control. But the bottom line is we want to try to move as much as possible. Number two, and this is really tricky, is that one of the reasons we're using H-Wave is to help us improve our sleep. That we know that it's going to be very difficult to have complete healing or to help remap the brain around perceiving what's going on with my body if I have incomplete sleep. And so our model is, hey, let's go ahead and just lay in bed for 8 hours without looking at our phones. That might mean that I'm not actually sleeping because of my pain or my disrupted sleep or the patterning that's happened as a result of my condition. But what it does mean is that rest is the next best thing to sleep. So the very least, I'm going to get 8 hours of rest. Even if I just need to lay there and work on my breathing or lay in the dark, that's totally okay. So number one, let's get some movement. Number two, let's see if we can get you laying in bed and retrain our brains that we're going to rest for 8 hours without looking at our phones. Number three is nutrition. And it's very, very difficult because we want to self-soothe with sort of junky foods. But one of the things we're trying to do is make sure that we have the building blocks on hand to repair, restore, and potentially remove some of inflammatory agents that might just kind of keep this inflammatory bell of chronic pain and persistent pain ringing. So what we say is, hey, let's try to shoot for at least 0.8 grams of protein per pound body weight, which is actually going to be reasonable, but you're also going to have to work at it a little bit. And then the other thing we try to say is, hey, we need to get more fruits and vegetables in you. And specifically, I'm talking about micronutrients and fiber so that I can re-regulate hormonal systems, all the biology. But also what we find is that when we do that, we're eating 800 grams of fruits and vegetables, which could be 4 big apples in a day. We improve nutrition, we improve micronutrients, we improve fiber, we get some protein on board, and we start to see a system start to begin to take care of itself. And lastly, we just want to remind you, you cannot pull yourself out of your community. That it's really important that we try to limit the social isolation that often comes along with persistent pain or chronic pain conditions. Which means, even though I feel terrible and then my friends know I feel terrible, I need to go engage in 10 minutes or 15 minutes or see someone in my neighborhood or call a friend, but I cannot just isolate myself. Oftentimes when we're managing this really, really gnarly pain, it's difficult for us to imagine ourselves as members of the community. But that in itself, removal of us being humans with other humans, is an existential threat. And ultimately, those behaviors of walking, of sleeping, of nutrition, of being in fellowship with other people are some of the key aspects that help remove threat so that I can let this H-Wave do its magic and I can return my body to its native state, which is pain-free and engaging with my community and in my household.